Hey everyone, in this video I'm going to discuss some important details to be aware of for delusional disorder. It's important to understand what a delusion is, and a good way to think of a delusion is as a fixed false belief that is not based on reality and is held with conviction. So in patients with a delusion, they'll believe in something so strongly despite the fact that it's not grounded in reality or that there's evidence to disprove it. These patients will continue to believe in it so strongly because it seems so real to them. There's a lot of different types of delusions, and this table does not even include all of them, but these are some ones that I thought would be good to go through. So we could start off with delusions of control, and this occurs when other people control the patient's actions. And then we have thought broadcasting, where others can hear the patient's thoughts. Thought withdrawal, where the patient thinks that other people can steal their thoughts. Persecutory delusions are when the patient believes that other people are conspiring against them. Delusions of guilt, this is when a patient feels guilty for doing something. Even if they didn't do something, they might still feel guilty for it. Or if they did do something, they feel excessively guilty. And delusions of reference, this is when a patient believes messages are directed at them. For instance, like someone on the news sending out messages to them. Somatic delusions are when the patient believes that they are sick or diseased. Erotomanic delusions are when they think that someone else is in love with them. You can have grandiose delusions, which is when a patient believes they have very special abilities or feel very powerful. And jealous delusions, this usually relates to the patient thinking that their partner is being unfaithful. So in regards to epidemiology, the lifetime prevalence of delusional disorder is only around 0.2%. There does not seem to be a difference in the frequency in regards to gender for delusional disorder. And then some common risk factors are family history, advanced age, and isolation. So it's definitely important to be aware of the DSM-5 criteria for delusional disorder, and we'll go through the different criteria. So first off, for criterion A, there needs to be one or more delusions that persist for 1 month or greater. And this is the really important thing about delusional disorder, is that this delusion needs to have persisted for more than a month. If it's only been 5 days, you can't diagnose it as delusional disorder. Moving on to criterion B. And so criterion B actually relates to the criteria for schizophrenia, and it says that criterion A for schizophrenia must never have been met. And so to rejog your memory, here is criterion A for schizophrenia. It says that at least 2 of the following, each present for a significant portion of time during a 1-month period, and at least one of these must be 1 through 3. So 1 through 3 include delusions, hallucinations, and disorganized speech. And then we also have grossly disorganized or catatonic behavior and negative symptoms. So now that we remember what criterion A is for schizophrenia, we can go back to our criteria for delusional disorder and recognize that if criterion A was ever diagnosed, then delusional disorder would be excluded. Moving on to criterion C, functioning is not markedly impaired and behavior is not obviously bizarre or odd. So generally for delusional disorder, they do have this belief, but it's really not impacting their day-to-day life. They're still able to go out to work or hang out with family or do the things that they normally do. They just have this belief, but it's not really impacting them on a day-to-day basis. Next, we'll move on to criterion D, which says if manic or depressive episodes have occurred, they've been brief relative to duration of the delusional periods. And then criterion E, the disturbance is not better explained by another medical condition or use of a substance. So this kind of ties back in with criterion B, whether it's schizophrenia or any other medical condition. If that could better possibly explain what's going on, then we would not consider delusional disorder to be that diagnosis. Similarly, if a patient was under the influence of some substances during the time of these delusions, you would need to exclude substance use as one of the reasons that these delusions had occurred in order to diagnose delusional disorder. In regards to the treatment of delusional disorder, you definitely want to consider a comprehensive approach. So this consists of psychotherapy. Both individual and group therapy are options here. In regards to medication, there are no FDA-approved medications. However, some antipsychotics have been studied for the treatment of delusional disorder, and it's something to be considered. Some options here would include risperidone and aripiprazole. And lastly, you want to make sure that the patient is in the right setting for them to feel safe and thrive. So this includes lots of family and social support. So here's an example for us to consider. This says there is a 36-year-old computer engineer who believes someone has been trying to poison his food for the past 7 months. As a result, he refuses to eat any food that does not come prepackaged. Otherwise, the patient has no issues. He gets along well with his family and coworkers, and he has no other psychotic symptoms. So a patient like this would meet the criteria for delusional disorder. So his delusion is that someone is poisoning his food. He's not experiencing any other psychotic symptoms, so we're not really thinking that it could be due to another medical condition. Additionally, his functioning is not impaired. It says he's still getting along with his family. His behavior is not obviously bizarre. So this patient would meet criteria for delusional disorder. So the last concept I wanted to touch on was folie à deux. This is translated as shared madness in French. And so what this is a shared delusion between two or more people. And generally, it's consisting of people, in a family or who share a close relationship. And so these patients are experiencing the same delusion at once. And when it comes to treating these patients, the best course of action is to separate them and treat them individually. Thank you so much for watching. If you have any questions, please feel free to leave them below. Thanks.